Good morning and welcome to this edition of San Diego People. I'm Sandra Moss. Kids and teens all across San Diego County are getting ready to head back to school. This morning on San Diego People, we're focusing on what parents need to know to make sure their student is happy and healthy. We'll talk about strategies for establishing school routines and hear about a program that's changing the face of science in the classroom. But first, health. California lawmakers recently passed legislation requiring all students to get vaccinated. And here to tell us more is Dr. Anna Lee, a pediatrician from Tri-City Medical Center. Welcome and good morning.
Thank you. Thank you for having me.
Well, let's talk about this new California Vaccination Law. It basically requires that all students, not only in schools but also in preschools, be protected against 10 different diseases, right?
Right. So the new law basically states that whether you are in public or private, preschool to daycare to elementary school or secondary school, that they all be vaccinated or show proof of immunizations for 10 infectious diseases. And those are diphtheria, tetanus, whooping cough, which we commonly know as, or pertussis, which we commonly know as whooping cough, and Haemophilus influenza, poliomyelitis, hepatitis B series, measles, mumps, rubella, and chickenpox. The law also states, though, that if in the future, it opens the door for future vaccinations that might come on board as requirements, but those are not at this point as part of the ones that will still have the personal belief exemptions for those. So it doesn't include any new ones. Those are the 10 that will be still on the book.
Now the difference here, and this law went into effect July 1st.
Will be in effect July 1st, 2016.
2016. So
right.
It's just being phased in right now.
Right.
So the reason this basically has gone into law here in California is because we have had some outbreaks of diseases that most people thought were eradicated.
Right. I'm sure most of us remember the recent measles outbreak that started from Disneyland and kind of went all over, including here in California mostly, but in Mexico too. But and that really prompted the legislation to kind of move ahead with, we need to protect our children. We need to make sure that the diseases that are preventable by a vaccine, very safe, very effective vaccines, will hopefully eliminate these outbreaks in the future.
Now, safety is always a concern of some people, and there have been for decades concerns about the MMR vaccine and autism, which has been discounted in many studies, but still there is a segment of the population that is convinced there may be some sort of a link. And it used to be, before this law went into effect, that parents could out because of their religious beliefs, correct? And that's what the difference is with this new law. You cannot do that anymore.
Right, religious or just personal belief, those are no longer an option for the parents.
And what is your feeling? You must be getting a lot of questions from people who are maybe concerned about some of the vaccinations. What do you tell your patients?
I try to really be as helpful in educating them and making sure that I do listen, I do hear their concerns, and it is their baby, and this is not something that we as pediatricians just take it lightly, and we're not just doing it based on these are the recommendations, so we need to just do this. It's really just trying to explain to them that really it is that important. These diseases are not all gone out of the circulation, and we do live in a very global world. It's not just San Diego or whatever county that or the community that they live in, and there are ways that these diseases can come back and haunt us, like the recent outbreak with measles. In terms of safety and the concerns for autism, I really try to just help them understand that the science behind that is just not found. So though there's that emotional tug, really when you kind of try to look at it as objectively as you can, the science just isn't there to support the concern for autism with MMR.
There is a new vaccination. It's for HPV, the human papilloma virus, and it's not required under this new law. But it is something that a lot of parents are being asked about, and it's a series of 3 shots that children get to protect them from this virus. It used to be for just girls, but now they're asking pediatricians to immunize boys. Could you explain what it what that's about?
And that's actually the recommendation for boys started actually 7 years ago. So it's not necessarily new. It's new to a lot of the parents that are out there. But and the Gardasil, the HPV virus vaccine, one of the vaccines actually, has gone through its changes too. It used to be that it only had 4 serotypes that were represented.
What does that mean?
That there were 4 that were chosen to in the vaccine because there are multiple different types of serotypes amongst human papillomavirus.
Like 20 or something,
yes,
right?
And those 4 really represented 2 which represented 70% of what causes cervical cancer and 2 that represented 90% of what causes genital warts. The new vaccine that was recently licensed by FDA is 9 serotypes. So that essentially moves the cervical cancer coverage to 90% actually, and the genital wart still stays at the 90%. So regardless of whether you are protecting a woman from cervical cancer, you're also protecting all the other segments of whether it's further testing that woman would go through, but also from genital warts. I mean, warts in areas where it's pretty uncomfortable and painful and something that needs to be surgically removed on a regular basis. So it's really trying to convince parents that both girls and boys will benefit from this vaccine.
And when it comes to entering 7th grade and 8th grade, I know that if you opt out of having your children vaccinated, you can always send them to private school or homeschool them. Is that the alternative?
So not private school, but homeschool or home-based private school, which we know commonly as homeschooling.
Okay.
Or the other option is independent study programs where essentially you're doing all the work at home and they won't be in a classroom, instruction setting.
What is the most important thing before we leave today that you want parents to know about this new law? What is crucial for them to understand?
That the new law was really made to protect your children and the children that is around them. That it is really important for parents to understand that this is not to take away their rights, but more that we're just trying to protect the children and the community as a whole. And so take a look at it.
If you want them to get into school, you better make sure they're vaccinated.
That's right.
All right, Dr. Annalee, thanks so much for your time.
Thank you.
Appreciate it.
Thank you.
When we come back on San Diego People, we are going to be talking to a mental health expert about strategies to make sure your student is happy, organized, and stress-free this school year. San Diego People will be right back.